Virginia Crothers. I go by Ginny. I am 67 years old and have lived in Bellingham for about a year and a half. My days, since I'm retired, are just very fluid. I go to the grocery store once a week and I put on, the requisite full hazmat when I go. And that's okay. Once a week I can do that. I have a number of friends who are real gardeners. So I want to give them the garden tour, the plans of the garden tour. And then have the family from Seattle come up and see what's been going on. I'm looking forward to that. Additional things that I'm doing these days that I didn't before was that I belong to the Center for Spiritual Living. And since we can't meet for Sunday services, they're doing stuff on Zoom and online, but there's also a group of us that get together, and they kind of assigned us to 9 or 10 people in a group, whether you knew them or not, because it's a fairly good-sized congregation. So once a week, the group gets together on Zoom, and I've actually met people that way, which is kind of different. It's something I did not anticipate.
So this is Kahira, and she's 5.
I'm Naima, and I'm 7 years old.
And my name is Brielle, and I really, I'm 36. I stopped counting a long time ago, so ask me my age and I'm gonna stand there and think about it for a while.
But we still count.
Trying to clear my head, sitting waiting to be fed, 'cause everything has turned around.
She'd just gotten over being sick, and we just started trying to get back into her going back to school, and then all of a sudden it was like, no school. So it was difficult finding our footing. We lost our routine last year when their dad sold the house out from underneath us, and we became homeless from September until December. So we had just established a routine, and losing that routine was really, it was difficult. And the anxiety, the thought of just going out, being exposed when I have 2 children that are reliant on me is terrifying. If I get sick, there's nobody to take care of them.
My name is Cameron Whitley, and I'm an assistant professor in the Department of Sociology at Western currently.
I am Melanie Whitley. I am an assistant professor of political science and public policy at Rutgers University.
In New Jersey.
In New Jersey. It's a little complicated. And this is our son Oliver Whitley, who is 2 months old. He has been the most interesting thing that's happened to me in a while. In terms of teaching, everyone I know is just struggling so much because of the transition and because they're trying to take care of kids at home and teach, and it's a lot of work. Online teaching is a totally different way, not only of teaching, but of thinking about what you're teaching. When things started to get sort of bad, not quite when all of the stay-at-home orders, but before that, we were in the hospital. He had just been born, and my sister, who has a friend who's a high-risk OB, called her and was like, you need to tell them to get out of the hospital because things are going to get really bad, or potentially get really bad.
Yeah, I think that the biggest thing that has changed for me is that we really had set up all of these systems for our families and friends to come visit. And that has been, like Mel said, that's been really, really hard to try to figure out how do you navigate having the newborn without any support. So I can't imagine what it's like for single parents right now without any other support. I really can't imagine.
Especially single parents who are trying to work or go to school or all of the things. I read this woman on the moms group I'm in Facebook. She works nights, and then she's trying to take care of her kids during the day, because normally she would sleep during the day when they're at school, but they can't go to school. So she's just at her wit's end.
Me and Kahira are going to give you your Mother's Day presents.
Okay.
Kahira, you can give her it. You like it? I love
mom face. Thank you so much. Thank you so much. I love it.
My name is Paige. I use she and they pronouns, and I love to grow vegetables. And I'm the manager of the Queer Youth Project at Northwest Youth Services.
And my name is Kristen. I use she, her pronouns, and I'm a nurse practitioner. And this is our little one, Fern.
It has been a tough transition. There's so many parts of my work that is fine to do at a distance, but a big part of my work is advocating for and supporting young people. And that's become a lot more challenging to reach out to them, but also a lot of the work that we were previously doing was about building hope and galvanizing community and creating positive narratives for queer and trans youth.
My company switched to all virtual visits over the course of a week, and it was a big learning adjustment for everybody, patients and providers.
And it was hard when Fern didn't want to go down for her naps, because she'd be crying and I'd be trying to do the nap routine and Kristen's in the other room on a call with a patient and I'm trying to protect her confidentiality space. It was a lot of juggling. So I grew up in a farming family and my grandfather always had a large garden. And then when I was in my 20s, I started gardening too. And then, I don't know, over the last 6 years or so, it's become a much bigger part of my life. But I've been growing gardens and food for probably 12, 15 years.
I think it's been helpful for mental health too.
I was just gonna say, yeah, like it's kept me busy. It gives me something to do. Starting all the plants from seed and taking care of the garden beds and helping some neighbors with gardening projects too. So.
I could see us like fully having like a second wave of this hitting, and then where are we at? Everybody's so eager for everything to open up, but what are we risking for that? There's so many levels of sanity for a parent and a single parent. This one loves to paint, so lots of craft supplies, paint supplies. She's my book dragon, she's like me.
I don't pretty much have a favorite. Every book is pretty much interesting.
Do you want me to read your poem or you want to read it?
You read it.
Okay, so her poem is titled The Coronavirus. School gone, virus is long, makes me sad plus mad. I can't go out to play, no friends, because the virus is free today. 2.99 million worldwide sick from COVID-19, this virus is mean. In my county, 288 confirmed cases, 27 deaths. That's scary. It's stolen people's celebrations, Easter, parks, socialization. Made us scared of hugs, not the dark. I just want it to go away. I don't want to live in quarantine another day. I'm tired of mom saying what we cannot do because of COVID-19. Wear masks to keep germs away. Stop touching your face. Tired of wash my hands a million times. Can't go to school. I feel like I want to boo-hoo. It's kind of cool that the earth gets to heal, but this virus is an awfully big deal. Animals get it too. This virus doesn't belong here. It's wrong. Stay strong.